Well, hi everybody, this is Dr. Schroeder with a video introduction to week number 4 in our class in the theoretical basis of teaching and nursing education. Well, first of all, I have to apologize. I still have a little bit of a frog going on in my throat, so hopefully I can make it through this little introduction video through the next few minutes. But just to recap, had a pretty good week this week. In the discussions, of course, we discussed your discussion question, which was identifying for your Foundations of Nursing Practice course. Um, what would be some good, the primary focus was on the objectives that you would write and the objectives that you would identify. And most of the feedback throughout the class was really trying to hone you in on making your objectives somewhat workable or measurable, or something that at the end of the class you could go back and say, yep, this is an objective that was met or wasn't met. That's always a challenge in nursing education because it's not as easy as it sounds. We can come up with what we think are some great ideas of what we want students to do, but quite often on the first run through or the first time we develop a course, when we look at those objectives, they're oftentimes very vague, and it's difficult for a student to say whether they were really met or weren't met. So it's important to understand that words and terms are important here. We need to use terms that are not subjective, and that it really indicates some behaviors that are something specific that we want to see, or something that we can point to say that yes, this is something that the student learned and that the student gained. For example, saying that a student will improve their writing skills, or if one of the objectives is to become a better writer. Well, that sounds great, but in a writing class, how do you know if they're a better writer? So it'd be more specific to write and better to write that an objective is. In this course, the paper will develop the ability to write up to a 2-page essay with no more than 5 instances of errors to grammar within the paper, or something along those lines. That's just a simple example, but that's kind of what I'm getting at. Something that you can look at to say, here's what the student did, here's what they were supposed to do, here's what they actually did. And then that kind of gives you a basis to say whether or not they were successful in meeting those objectives or not. This week we're going to continue on with this. We're going to talk about how to assess and evaluate those objectives, and how to assess and evaluate student performance. And again, this is something that's kind of tricky. And don't worry if through my feedback and the feedback of your classmates, if you get post something and come back and get some feedback to rethink it a little bit, because in the real process of education, we're doing that all the time. Again, the first run through, we write something, we think it looks good, then we give it to other eyes or have other people look at it and get a little bit of critique, and it's very common to go back and rethink and to reevaluate things. To always come up with what is really the best and the most appropriate evaluation strategy. And that's really going to be the focus of this week. The discussion question is essentially, if you were a faculty member who had access to the student ability to apply Socratic questioning technique in a clinical setting, how would you do so without being in the clinical setting? And in other words, if you're sitting in a classroom with a student and you're doing teaching on something that they're going to be doing in the hospital, how do you know that they're getting it? How do you know that they're really going to understand it? How do you, in the classroom, know that they're actually getting that transfer of learning, that they're actually picking up those skills that are really important? And that's what we're going to be discussing this week. Also due in week 4 is going to be your teaching plan. This is the teaching plan that you started this week, and it uses some components from your week 3 discussion as well. And again, once again, you'll be turning those plans in. I have graded all of your first papers, your week 2 papers, your week 3 papers. Yes, your week 3 papers have all been graded and returned. Please refer to my comments. Let me know if you have any questions. Overall, very good job. You're all very good writers. There was quite a bit of variation in the application of APA skills. So I left you quite a bit of APA feedback and some structural feedback on some of you. So you want to make sure that you review that feedback, and always let me know if you have any questions. One thing that was fairly consistent among many of you anyway is that I would encourage you not to use a lot of direct quotes, or if you do use direct quotes, you always have to interpret what that quote means. You can't quote another writer and include that information in your paper and kind of point and say, see, so this is what the writer says, so I think it's great, so I'm going to move on now. You have to explain why, how it relates to your paper and to your paper purpose, and always substantiate your ideas and your thoughts with substantiation from the nursing literature. But overall, I think class is going very well. I'm very pleased with what I've seen so far. Again, as you have any questions, let me know. If you have any questions about the grading or any of the feedback that I've left, I'll be more than happy to address that with you. The idea is to give you feedback so that you can improve as you move on. And I look forward to participating in class with you once again this week and reviewing your papers, and we'll see you in the discussion forums.